Guys, in this video, let us look at this Mother and Child Protection Card, okay, MCP card. This is the English version. Actually, in every state, you will have it in the regional language. So look at this. This is from the Ministry of Health and Family Welfare, Women and Child Development, National Health Mission. This is India, right? So directly here below the photo, they have something here on the front page is the pregnancy high risk, okay. Here, the lady's name, her age, okay, this is the husband's name, address, mobile number of both the lady and the man. So basically here they are going as per the child. So mother and father. MCTS RCH ID. What is this? So that's nothing but mother and child tracking. Okay. And RCH is reproductive child health. Isn't it? Reproductive child health ID. Okay. So are you able to see this? Then bank branch name account number. Okay. Then pregnancy record. Last menstrual period, expected date of delivery, number of pregnancies that she has had, live birth she has had. Last delivery was conducted at the current delivery, birth record. So current delivery is if it happens, right? So they will update it here. Birth record, the child name, that is the child which is born, date of birth of the child, weight of the child, whether it is male or female, and birth registration number. So this is the birth registration number. Again here the mother and child tracking system and the reproductive child health ID. So the third section, guys, here is the institutional identification. So AWW number. What is AWW? AWW number. AW is Anganwadi worker. So Anganwadi worker number, block, village, ward, ASHA, that is, what is ASHA? Accredited social health activist, okay, and ANM or auxiliary nursing midwifery. So many terminologies here. What is SHC clinic? PHC, definitely we know, primary health center. What is SHC? It is sub health center, okay. PHC, primary health center. Hospital, FRU. What is FRU? It is first referral unit, guys. ANM, you saw auxiliary nursing midwifery, her contact number, hospital contact number, AWC registration number. Now what is AWC? So this is the Anganwadi, AW, you can assume Anganwadi center registration number, okay. Then subcenter registration number, date, referred to, child's Aadhaar number, mother's Aadhaar number, ambulance toll free number. So everything in the first page. So basically first page we have covered now. First page has all these main information, all the helpline numbers, the name of the people who are attending, okay, referral, first referral, etc. All the important numbers, okay. So that is first page. Now let us go to second page. So we're still in the second page. We'll go faster from now. Regular checkup is essential during pregnancy. Okay. So what is this? First month, second month, third, fourth till ninth month they are showing. Register with health center in first trimester. So in the first trimester you're supposed to register. That is when when they register they should give this card, right? This is ANC. Antenatal checkup. Have at least three antenatal checkups. Okay, after registration you should have at least 3 antenatal checkup. Have blood pressure checked. Okay, then have the blood pressure checked, have the blood and urine examined at each visit, okay. Weight should be checked at each visit. At least you should gain 10 to 12 kgs during pregnancy. During the entire pregnancy, they are saying 10 to 12 kgs. 1 kg every month during the last 6 months of pregnancy. 2 TT injections. Okay, you can read more about this here. So 1 iron and folic acid tablet. Okay, at least for 6 months after the first trimester. Iron is after the first trimester, but I'm guessing folic acid should be in the first trimester itself. Iron will be after first trimester. There should be total 180 tablets. So 6 months. So 1 daily. So 6 months into 30. 6 threes are. What is 6 threes are? So that adds up. 6 threes are 18, yeah. So then calcium tablets, 2 tablets per day. For 6 months again after first trimester. So after first trimester only they're telling all these. Single dose of albendazole they should take. This is for deworming, isn't it? After first trimester. Why they are avoiding first trimester? Because organogenesis is happening. So they want to avoid any medication. But folic acid definitely they will give, isn't it? How's it going, guys? Let's continue. Care during pregnancy. Consume variety of foods, more foods. You can read all this. Then consume SNP from AWC. What is SNP? Consume SNP from Anganwadi Center. What is SNP? That is supplementary nutrition program from Anganwadi. Okay, then you have to rinse the mouth after every meal, brush your teeth twice a day. What and all they're telling, huh? 2 hours of rest during the day, additional 8 hours of rest at night. Use only adequately iodized salt. Okay, to maintain all the thyroid levels. So people, we are moving on to the third page. Antenatal care. Obstetric complication in previous pregnancy, please tick if it is relevant. So if the person had APH, what is APH? So if there was any antepartum hemorrhage, if there was eclampsia, that is seizures, PIH, pregnancy induced hypertension, anemia if they had an obstructed labor, if they had postpartum hemorrhage, if they had a cesarean section, if they had any congenital anomaly in the baby in the previous pregnancy, others. So guys, shall we move on to past history? Past history, again, tick the boxes. Past history anytime in their life before, not just during pregnancy. If they had tuberculosis, if they have hypertension, if they had heart disease, diabetes, asthma or others. Okay, so you understood some diseases, they are asking the previous history. Examination. So when the person examines heart, lungs and breasts, check for inverted nipple. Shall we move on, guys? Okay, we are in the antenatal part of the what card? Mother-child protection card. Antenatal visits. So how many visits? They told at least 3, right, after registration. So here they have allowed up to 5. So because for some special cases they want. Anyways, you are welcome to go and show extra times. Date of the antenatal visit. Any complaints? Period of gestation in weeks. Weight in kgs. Weight, how it is increasing, they can know. Pulse rate, blood pressure of the mother, pallor, edema, jaundice. Okay. Abdominal examination, what will you see? Fundal height of the, that is the uterus height, right? Then the lie, the presentation, is the baby lying breech, cephalic presentation, what is it? Fetal movements, is it reduced? If it is reduced, it's really bad. If it is absent, it is really, really bad. So fetal movements are very important. Fetal heart rate per minute. So heart rate also they have to measure. Okay. PV if done. Per vaginal examination if done. Okay. Okay guys, let's move on now. Essential investigations. Hemoglobin, did you check? Urine, albumin, did you check? Albumin. So that indicates proteinuria, albuminuria. Sugar in urine, pregnancy test, urine pregnancy test. HIV screening is required so that they can stop parent-to-child transmission. Syphilis for STDs, ultrasonography. Syphilis comes under torch, right? All the torch infections they will check so that there is no congenital anomaly in the child, right? Where is syphilis sitting in torch? In others? In S? Or is it T for treponema? T is actually for toxoplasmosis, guys. So syphilis is in the O only, others, okay? So you should check for what and all are the important ones. Torch infections, toxoplasmosis, then O for others, then you have rubella, cytomegalovirus and herpes infection. Cytomegalovirus also, it is torch, okay. Ultrasonography. So what did you do in the ultrasonography? You checked the crown to rump length, the exact period of gestation, expected delivery date, checked for anomalies, checked dating scan, anomaly scan. What else? Okay, gestational diabetes mellitus, so GDM. So if the mother has diabetes during pregnancy. Blood group and RH typing. So that is important, mother's blood group and RH typing, because if she is negative and the baby is positive, they'll have to have some extra precautions. Optional investigations. Optional, they can check thyroid stimulating hormone. Then they can check for HBsAg. Why is this? HBsAg. Hepatitis B surface antigen. Okay. Blood sugar. Okay. Great guys, we have reached page number 4. Okay. So we are going to page number 4 now. So in page number 4, if you or anyone in your family sees any of these danger signs, take the pregnant woman to the hospital immediately. If she is bleeding, okay, severe anemia is there, breathlessness, high fever, okay. If there is headache, blurring of vision, Fits, swelling, so this can mean preeclampsia, eclampsia, right? Then labor pain for more than 12 hours, okay? Bursting of water bag without labor pains. So basically they are trying to have an institutional delivery, ensure that people deliver at an institution rather than at home, so they can get all the emergency services, etc. So you have to contact the ASHA, ANM, AWW, you have to register in the Janani Suraksha Yojana. You can obtain all these benefits under this Janani Suraksha Yojana. You can identify the hospital in advance, arrange for transport in advance, ensure 48 hours of stay after delivery. Well, in case it is going to be a home delivery, the preparation, they are telling clean hands, clean surrounding, clean blade, clean thread to tie the cord, clean set of clothes for the newborn, ensure safe delivery by an ANM. Who is ANM? Auxiliary Nursing Midwifery, right? ANM. Then ensure family support and care. In case of an emergency, again, even if it is home delivery, arrange for hospital, right? Arrange for transport and initiate breastfeeding. Within 1 hour of birth, you have to take this. Family planning and counseling, very important, because after delivery, that is when they have to be more cautious about pregnancy. How's it going, people? Look at this. Ensure early and exclusive breastfeeding up to 6 months. Okay, exclusive breastfeeding and early also. Okay. Now let's go to postnatal care. The delivery is over. Postnatal care. So here you are going to say after the delivery, the date of the delivery, where did the delivery happen, type of delivery, was it a normal delivery, was it an assisted, was it a C-section, was it an abortion, if it was an institutional delivery, how many days post-delivery they stayed there, complications, if any complications specified, gender, sex of the baby, male or female, weight of the baby. Very important to know if it is a low birth weight baby, etc. Did it cry immediately after birth? Did they give breastfeeding within 1 hour of the birth of baby? Then what else? 3 extra visits. If the birth weight is less than 2.5, then they have to get 3 extra visits. Vitamin K injection, was it given? Now we are moving on to postpartum care. So first day, third day, 7th day, 6th week. 6th week. Okay, first day, third day, 7th day, 6th week. So any complaints are there? Mother, pallor, pulse rate, blood pressure, temperature, breast soft, engorged, if the nipples are cracked or normal. Uterus, is it tender? Bleeding per vagina, excessive or normal. Lochia, that is the discharge, right, from the uterus. So lochia is the vaginal discharge after giving birth. It can contain blood, mucus, uterine tissue. Okay, if there is any foul smell from that. Episiotomy, if it was done, how is it looking now? Family planning, any counseling did you give? Any other complication? Care of baby. So did the baby pass urine? Did it pass stools? Is there any diarrhea, vomiting, convulsions, activity? Is it sucking, breathing? Is the chest indrawn? Temperature, jaundice, umbilical stump, how is it? Skin pustules, any other complications? Guys, now we are moving on to page 6. Take a deep breath. Okay. Feeding, playing, communicating with the children helps them to grow and develop physically and intellectually. So what are they telling? Just a summary will tell you guys. So basically here they are saying feed the baby even if it is ill. Mother's first yellow milk protects the baby. Feed the baby, keep feeding so many times, and then if you have problem breastfeeding, you have to contact these ANM, ASHA, AWW workers. So after 6 months, you can add something with the breast milk. So here it says 6 months what to do, 6 to 9 months, 9 to 12 months, and general tips on hygiene, etc. Milestones, what the baby should do by 2 to 3 months, right? Social smile, eye contact, raise the head when on tummy. So how to massage, then cuddle and play, colorful moving objects. Now we are going faster, right guys? So look at this. If there is no social smile, all these danger signs they are telling. If it does not wake up to noise, and then if it does not make eye contact, or if there is any problem with the position, if there is squinting in the eyes, if there is some problem with the fingers. 4 to 6 months, what the baby should do: keep the head steady up, turn towards the direction of sound, attempt to reach, grasp, laugh. What is this? They babble. They look at themselves in the mirror. Parents should communicate with the babies. Then they should put interesting things for them and they should take them outdoors. So exactly according to that pattern, they are telling you what the signs are that you should, warning signs. At 7 to 9 months, roll over. Look for toys that are hidden in front of them. Respond to name being called. Okay. So here are the corresponding warning signs. Guys, this similarly goes on, okay, 10 to 12 months. Then at 18 months or by 18 months, by 2 years, by 3 years. Okay, now we are back, guys. We are already at page number 22, almost at the end. Great. So maintaining a spacing of 3 years between two children, right, has a healthy impact on the mother and baby's health. Okay. So you can talk about family planning. So injectable MPA, Antara program. Okay. What is MPA? MPA, they are saying it is medroxyprogesterone acetate, okay, hormone. So, Antara program, injectable. Then you have IUCDs, intrauterine contraceptive devices like copper 380A, Cu 380A, 375, postpartum IUCD, that is PPIUCD. PPIUCD, what is PP? Postpartum IUCD, within 48 hours of delivery, okay. Combined oral contraceptive pills. What is combined in this? So, estrogen and progesterone, Mala N, Mala D, Centroman, that is Saheli, you know about this, right? Non-steroidal, this is. It's also called as Chaya. Then progesterone only pill. That is if estrogen is not good for them. So, this is what? It is a non-steroidal oral contraceptive pill. We are back here to the mother-child protection card. Okay, here. And then they're talking about condoms. So basically what you can understand here is that there are a lot of options and the lady can choose what she wants, right? Either an injectable or an IUCD or a oral contraceptive pill or condoms. Okay. Here they are talking about the male condoms. Guys, now let us move on our focus to the child. Here they are saying that there should be iron and folic acid supplementation for child. For age 6 months to 5 years, compliance card. Okay. Provide iron and folic acid every Wednesday and Saturday. Give 1 ml of iron folic acid syrup using auto dispenser. Do not give iron syrup if he is sick or severely undernourished. So give it to the child after consumption of food. Okay. Guys, actually the growth chart, weight for age. Child growth, birth to 3 years, this is for girl. Actually, they have put it in 2 pages together. So anyways, just look at it. There is a green line here, yellow and a red. So here, what you can see, there is 1 year here, 2 here and 3 here. So 1, 2, 3 years. Here you have weight. So it's just weight to age. So what does it say? Normal, moderately underweight, severely underweight. Green is good, orange is dangerous, red is very dangerous. I think orange or yellow they meant. This is kind of important. Look at this. If there is diarrhea, breastfeed more, give extra fluid, give ORS, then zinc tablets, continue feeding, take the child to hospital if loose motion does not stop. If the child has fever, if the child has high fever, take her to the health care center. ARI, what is ARI? Acute respiratory infection. So if the child has rapid or difficult breathing, take him to the health center. Very similar for boy, except that the ranges will be different. So below 3 standard deviation, they are saying is severely underweight. Below 2 standard will be moderately underweight. So here they are saying the first 3 years are forever. Integrated Child Development Services, ICDS. Whenever there is a C, you can assume child. And so it is Integrated Child Development Services. So what are the services under this ICDS? Supplementary nutritional growth. Then It's there here. Supplementary nutritional growth, nutritional and health education, immunization, health checkup, referral services, early childhood and preschool education. Guys, okay, so now we spoke about immunization. So let's go to immunization. This is for the neonatal care up to 9 months. They have put what should be given: oral polio vaccine, hepatitis B, BCG, that is for preventing severe forms of tuberculosis. Then you have OPV1, pentavalent one, that is diphtheria, pertussis, whooping cough, and 2 other things which will be Haemophilus influenza B and hepatitis. Then you have the rota vaccine against the virus which causes diarrhea. Then you have PCV, that is pneumococcal conjugate vaccine. Then you have the IPV, injectable also. In our national immunization schedule video, we have already looked at it. And similarly, 2.5 months, 3.5 months, 9 months. 9 months, what is there here? MR, that is measles and rubella. Then you have the JE, Japanese encephalitis, a dose of vitamin A, PCV, again pneumococcal booster. So basically, they talking about the danger signs here. If it refuses to breastfeed, if it is unable to cry, having difficulty breathing, if it has yellow palms and soles, again indicating bilirubin. So if the baby has fever or if it is cold to touch, if it has blood in stools or convulsions, if it is lethargic or unconscious. So that was the first year of life. Now let us look at second year of life, after the first year of life. Basically the boosters and all these are boosters. Tetanus, okay, they're talking about tetanus toxoid at 10 years and 16 years, okay, and other vaccines they're talking about. SIA, guys, refers to supplementary immunization, okay. So then they're talking about all the vitamin A doses that they have given, right? Any missed dose also they're tracking. So they are telling about some messages, why the vaccine is given, when to come for visit, what are the adverse events that can occur and how to deal with them. So they have given all a lot of information here. BCG prevents tuberculosis, hepatitis B prevents liver disease, polio, whooping coughs, diphtheria, pneumonia, rota prevents diarrhea. Yes, MR, measles, rubella, Japanese encephalitis prevents, fights brain fever. Right, nice, right? They have given all information in this. Guys, we have reached the last 2 pages. Wow. And the last 2 pages are nothing but the counterfoils of the immunization. Just a copy is there. And this seems to be for the ASHA worker. So if she gets the child fully immunized, she'll get some incentive, looks like. That completes the mother and child protection card. Wow. This one was really informative, and every terminology you should know the full forms, right? Interesting. That's all for now, guys. Bye-bye.